Hello friends, welcome back. So I finished the first 10 questions. Now talking about the 11th question. This is extremely important definition of bias. Any systematic error. Mind you, I'm talking about a systematic error. Any systematic error in the design, conduct or analysis of a study that results in an erroneous estimate of an exposure's effects risk on the disease is called bias. People get very confused between confounding and bias. So any systematic error is basically called bias. Any random error is one which occurs by chance. This is important. Then which of the following is not part of ethics review of a project? Informed consent document and procedure, yes, it is part. Competence of researcher and institute conducting research, it is part. And sharing and protection of intellectual property, this is not a part of ethics review here. Care and support during and after completion of research. Yeah, this is also very important. Then, a study was conducted to assess the extrapyramidal side effects of an antipsychotic drug. You all know the extrapyramidal side effects, right, of antipsychotics. You can have a look at my CNS videos and get an inkling of what they basically are. In patients with schizophrenia, many of these patients were smokers and some of them were on anticholinergic drugs. Anticholinergic drugs, you have biperidine, procyclidine, triaxiphenidine. Okay, these are anticholinergics. Atropine. What was the role of the anticholinergic drugs in the study? So they were basically acting as an effect modifier. They were not a confounder, because confounder is one which affects exposure as both as outcome. For example, if you want to see the effect of blood pressure in smokers, but you also see some people drinking coffee. So coffee can be a confounder. It can also increase or decrease the BP. And smoking also with caffeine, it can increase or decrease the BP. So coffee drinking can be a confounder. But here it is an effect modifier. So the effect, we have to see extrapyramidal side effects. Some of them were smokers and some of them were on anticholinergic drugs. So anticholinergic drugs is basically modifying the effect. So we will see that has the effect reduced of extrapyramidal side effects by giving anticholinergic drugs, or has the effect reduced on extrapyramidal side effects by smoking. Then we can do a research. Then before initiating a study involving primary data collection, the principal investigator must ensure the various approvals are obtained. Which of the following approval is absolutely mandatory? That is ethics. It goes without saying that ethics committee approval. All you young PG students who are doing your MD and MS, all of you, after your protocol is approved by the ethics committee. Every institute has an institutional ethics committee. When I did my MD from ERA Medical College, Lucknow, then I sought approval from the ethics committee. Unless until the institutional ethics committee approved it, I could not have gone forward with my clinical trial. So after that, number 15 question is the policy makers, they want to know whether introduction of a new rotavirus vaccine. This is the most common cause of diarrhea, rotavirus. It is a virus. So diarrhea is 90% of the time it's viral. So they want to know whether the introduction of a new rotavirus vaccine in the national immunization program is resulting in the reduction of morbidity, means sickness, and mortality means death. Morbidity is sickness and mortality is basically death. So here they want to see that the introduction from what? From rotavirus disease. Which of the following studies will have, they have to conduct to find an answer. This is a field randomized trial, not a case control study, not an ecological study, and not a case series. All these are parts of descriptive studies. Like I told you this, observational, odds ratio, descriptive, case series, ecological, cross-sectional, case report, analytical, case control study, odds ratio is here you see, and cohort studies, relative risk or risk ratio. Odds ratio OR, control the case in the operating room. This is an easy way to remember odds ratio. Where do you use odds ratio? Control the case in the OR. Control and case. In cases and controls, we use odds ratio. Cohorts are used to measure the relative risk. This is extremely important. Then clinical trials also, you can see here, can I swim? First 4 phases of clinical trials can be easily memorized by can I swim. S is safety and acceptability. done in 50 healthy volunteers. Then, can I swim? Then, does it work? Safety, then W's, does it work? That is long-term safety, dose, schedule, early indications of efficacy. Low risk population, it is studied in 100 to 500 individuals. Swim. I, third is any improvement, like is it effective? Effectiveness is tested in high risk population greater than 1000. And can it stay in the market? That is post marketing surveillance. Once the study is introduced in the market, every 1 to 2 years they have to submit a data to the central DCGI, Director General of India, Drugs Controller General of India, DCGI, to check whether it can be staying in the market or it has to be removed. That is post-marketing surveillance. This is community-based and greater than 1000 volunteers are involved in this. Then, after field randomized trial, this I have told you, rotavirus thing, just a revision, they want to know whether the introduction of this vaccine is resulting in reduction in morbidity and mortality. People get confused in case control ecological. It is a field randomized trial. Then, what effect does increasing the sample size have upon the random error? It increases the random error. It has no effect. Obviously, it will reduce. You increase the sample size, it will obviously reduce the random error. That is the problem. Like I also did a research study, a clinical trial, but the problem in such clinical trials is you can reduce error, but then you have to increase the sample size. That means you have to do a lot of hard work also. And during MD, such work done is a bit difficult because you have to study also. So to reduce random error, you can increase the sample size. This also I'll be talking about shortly, more in detail about it. Then which of the following will best describe the scientific inquiry that seeks to understand the acceptability and functionality of a health program? Basic science research, translational research, clinical research, or implementation research. So this is best explained by implementation research that seeks to understand the acceptability and functionality of a health program. Then here I will be talking to you about